Okay, well, thank you everybody for joining us. I'm Franklin Escobedo. Again, I'm the Community Services Director here at the Larkspur Library. And we're here today with Geri Newell. And Geri Newell has been a certified HICAP volunteer for 2.5 years now. And her role today is to help you understand the changes and choices you have in Medicare in 2021. This presentation is about 45 minutes and there should be time at the end for a few more questions. But if you do have a question as we're talking, just type it into the Q&A box. And then when we get to it, I'll relay the question to Geri. So welcome and thank you again for joining us this afternoon. And I'm going to hand it over to you, Geri. So thank you.
Okay. Well, thank you very much. And thank you, Franklin, for arranging all of this. As Franklin said, my role today is to help give you some perspective on the changes that are made every year during this time of annual enrollment to some of your Medicare choices. I am a volunteer. I've been here for a little over 2.5 years. And as such, I am here to help educate you, but not to sell you anything and not to certainly tell you what to do. Those decisions are yours. But for those of you who already have Medicare, that's who this is primarily focused on, because you can make changes during this annual enrollment time. If you are brand new to Medicare and you haven't yet decided which way to go, there'll be some information here that will be very helpful for you, but I would encourage you, and I think Franklin has the link to our website where you can sign up for kind of the basics of Medicare, or end up getting an appointment with someone like me or one of my colleagues to have a one-on-one virtual tutorial, if you will. So with that in mind, we're going to move forward. And I first wanted to tell you a little about HICAP. And HICAP was actually legislated in 1986 by Congress through the Community Living Agency, which is under some other department. Don't ask me which one. But basically what Congress decided was Medicare can be very confusing and people may need unbiased help to kind of figure out what they want to do. And so the national program is called SHIP, S-H-I-P, State Health Insurance Program. And here in California, we call it HICAP, which is Health Insurance Counseling and Advocacy Program. But there's one in every state, similar to a SHIP program, although they might call it something else. And the funding comes from both the federal government as well as state funds. And that comes in California through the Department of Aging and then to local area agency on aging. Sorry, I don't know what I did to that. To make it move. So we offer these educational seminars as well as one-on-one counseling, and that's basically who we are. So every year, everything changes. And this year is no different than any other year. So first, we're going to start with some of the basics of Medicare and then get into some of the changes that you can start to think about if you want to change how your delivery of Medicare, what your option for delivery is. There are two ways. You have a choice to make every year at this time. You can go with original Medicare or you can go with an Advantage plan. In each case, you have to have A and B first. So everybody who's on Medicare, whether you're getting a Medicare Advantage plan or you have original Medicare with a supplemental, you all have your blue and white card with your A and B number, with your number, and it says the effective date of your A and the effective date of your B. So everybody's got that. That's your entry fee, if you will, entry ticket into deciding whether delivery system original Medicare, delivery system Advantage. So if you have chosen or are currently thinking about getting original Medicare, you think of it as a stool with 4 legs. The first leg is Part A. Part A is really the original Medicare, signed by Lyndon Johnson in 1965, and it provides inpatient care. If you have worked in the United States for up to 10 years or 40 quarters and you're a legal citizen, you get Part A with no premium. So there's not a monthly premium for Part A. And Part A covers everything to do with what happens to you when you're sleeping at a hospital or a skilled nursing facility / rehab. There is usually a deductible of about of varying amounts. This year in 2020, it's $1,408. We haven't been told yet what the deductible will be for next year. And if you were in the hospital for, let's say, 10 days or whatever, you would pay that $1,408 upfront, probably within a day or two. And then the next 60 days would be on Medicare. They would pay the whole amount of 60 days. If, God forbid, you were in the hospital for 61 days, up to 90 days, that would be on you. And there would be a daily stipend fee of, this year, I think it was about $350, that would be on you. So if you have chronic diseases or there's something that puts you into the hospital for more than 90 days or more than 60, you can see how that could all add up, which is why many people say, well, I need help with that out-of-pocket cost, which is why people get a Medigap / supplemental plan. And we'll talk about that in a few minutes. So that's basically what Part A covers. You're admitted to the hospital or you're admitted to a skilled nursing facility and you have to stay there overnight. Part B, which was enacted a little after Part A, in the early 70s, I think. Part B, as in boy, covers everything outside of an inpatient service. It covers your doctor's visits. It covers getting your labs done, x-rays, outpatient surgery. And for Part B, there is a premium. The standard premium this year, 2020, was $144.60. And if you are taking your Medicare, your Social Security benefit check, that comes right out of your check. If you're not getting your Social Security check yet, then you're being billed on a quarterly basis for that $144.60. Now, some people pay more based on their income, and some people pay less or nothing if they're qualified for Medicare. Okay. And once you have met the deductible for Part B, and again, this year it was $198, whether you met that going to the doctor and going to the lab and getting an x-ray or a mammogram or whatever, once that's all rolled up to $198, then Medicare pays 80% of any approved charges. Important thing to think about, approved charges. They pay 80%, you pay 20%. So you can see we got another out-of-pocket cost for you, and that is the 20%. If you go to the doctor a lot, if you have a chronic disease or have some serious health issues, that 20% can certainly add up quickly. And it is, again, what Medigaps were developed was to help you pay for those approved Medicare charges that are on you as far as the 20% for Part B and the daily expense for Part A. All right. Now, Part D came along just not that long ago in the early 2000s under President Bush. And we're going to talk more about that, but that is the third leg of the stool. And that is all of your outpatient, go to the pharmacy or mail order. That is what those drugs are. That drug coverage is for. Part D covers those prescription drugs that you get out in the community. And then the fourth component is Medigap. And again, that is really designed to help you pay for those out-of-pocket costs related to Part B and Part A. Doesn't cover any drug costs unless it's something that's delivered in the doctor's office, like your flu shot or your pneumonia shot, or you get an infusion at the hospital. So that's what Medigap was designed to do. There are 29 licensed insurance companies in California, and there are 10 standardized plans. If you already have a Medigap plan, you have the ability on your birthday plus 60 days to see if there's one out there that is less expensive but still as comprehensive as the one you have. Again, we have a separate seminar on Medigap, and as well as on Original Medicare and Advantage. And I would encourage you to go to our website and check the calendar for when one of those might be happening that would be convenient for you. But those are the 4 stools of Original Medicare. And I don't know where this is going. Okay, so the other delivery system that you can opt for is an Advantage plan. It's either Original Medicare or an Advantage plan, but you always have to have A and B to get to go. So an Advantage plan, just in typical government bureaucracy, they like to confuse us. An Advantage plan is called Plan C or Part C. So we've got A, inpatient, and B, outpatient, and then somehow we skipped over C and went to D for the drug. And that's just because of the chronology of when these additions to Medicare were rolled out. So C, Advantage plans, came before the drug plan, which is why it's all out of whack. Anyway, that's just my explanation to help you understand how we got to C before, or D before we got to C. So there are advantages and disadvantages to Advantage plans, but basically what happens is this. You take your A and B and you say, I want to sign up with a Medicare Advantage plan. The federal government, Medicare, says, okay, fine, that's great. We're going to give the Advantage plan a monthly fee to take care of you. And after that, our hands are off. We're still going to charge you your Part B premium of let's just say 2020's premium is $144.60. We're still going to charge you that. But then we're going to take some money and give it to the Medicare Advantage plan. And if they keep you healthy, then they get to keep more of that money we gave to them. If you get really sick under them, well, they're going to have to eat the cost of all of that, which is where the whole concept of health maintenance organization came from. Is the whole incentive is to keep you healthy so that the spread between what they spent on you and what they received from the government for you is a nice big amount that they can use for other things, nonprofit or for their profits if they are a for-profit company. Any questions so far, Franklin, from the group?
So far, there's no questions in the Q&A. Don't forget, you can type in questions in the Q&A.
Okay.
So far, so good. So.
Okay. So that's basically the overview of Medicare choices as far as delivery systems. Your initial choice might have been Original Medicare, and now you want to think about maybe something else, Advantage, or right now you're in an Advantage plan and you would like to think about whether or not there's another Advantage plan that might be in the cards for you.
Okay.
So I think that what is really being said on this slide is that every year you have choices. There's an annual enrollment period, AEP. There's also a period where you can change your Medicare Medicare Advantage plan at the beginning of each year between January 1 and March 31st. A decision to make. You are the decision maker because you want to make sure that it's best for you. And our role here is to just help you think about what the pros and cons of going either way, and then you have to assess what you're comfortable with. Hopefully that all makes sense. So the AEP annual election period allows you between October 15th and December 7th to change your Part D plans. If you recall a few slides ago, one of the 4 legs of that stool under original Medicare is a Part D drug plan. You can change those plans now. And you should always look at what things you're on, what new products medications you might be on, because, your current one may charge you more than another one. And we can help you run a report for that. And I'll also show you where you can go on your own to run a report on what might be some options for you for Part D plans in 2021. If you are in original Medicare or on an Advantage plan currently, you can change your Advantage plan. So you can change into an Advantage plan from original Medicare, or you can change to a different Advantage plan if you're currently on one. Next is the MAOEP, Medicare Advantage Open Enrollment. What happens here is that if you are on a Medicare Advantage plan, let's say during this open enrollment period, you either just rolled over to Kaiser or you rolled into another plan, and on January 2nd, after your big celebration of January of New Year's, you have buyer's remorse and you're like, oh, I don't know about this. Well, if you were enrolled in an Advantage plan on January 1 and you have those second thoughts, you can change to another Advantage plan, or you can change back to original Medicare. So that is 2 time frames, October 15th to December 7th, and January 1 to March 31st. And that happens every year. You have the option to make a decision for yourself on what you want to do, if anything, each year. All right. So, not to beat the horse till it's very dead here, but this is really what we're talking about. How do you want your healthcare delivered? Delivery system, original Medicare, delivery system, Advantage plan. And there are important considerations to think about because you are a unique person. Maybe you travel a lot, or you will travel a lot once COVID restrictions are lifted and we can travel safely. In that case, one of the advantages with original Medicare is that anywhere in the country, you take your little blue card and blue and white card, and you go into any doctor's office who takes Medicare, and you'll get treatment. Any hospital that takes Medicare, you'll get treatment. So you don't have to ask for permission. You don't have to stay in a particular network. It has a lot more flexibility often than an Advantage plan. And if you have a comprehensive Medigap supplemental plan, it will also help you pay for those out-of-pocket costs. But it is that cost because what you have to think about, you got 4 pieces of original Medicare. There's a premium for Part B. There's no premium for Part A if you've been employed in the country for 10 years. So you have a B premium, you've got a D drug plan premium, and you've got a Medigap premium. So you have to add up all of those and say, well, I can afford it and I like the flexibility of original Medicare. Great. But if you're, a lot of people here in Marin, if they, were employed before they were 65, many people had Kaiser because Kaiser is a big insurer here in Northern California. And so a lot of people just go, well, I've been in Kaiser forever. I'm just going to roll over to Kaiser. And that's fine too. because you're comfortable with that and you like the service that you've gotten, but you still have the opportunity each year to change if that's what you want to do. There is usually less expense with a Medicare Advantage plan because you're paying your B premium, you always pay that, and you're paying sometimes zero. This year, I think Kaiser is $89 a month versus $99, which it is. I mean, in 2021, it'll be 89 versus 99. Some of the new Marin County Advantage plans have no premium at all. But usually you're confined to a particular network of doctors. You know, we all know Kaiser's more of a brick and mortar. You go into that building and that's where all their doctors are. But, you know, Secure Horizons and Anthem, that's a network of doctors. And if you want to see a specialist, you oftentimes have to ask for permission and get a referral from your PCP, and it's only to a specialist within the network of that particular health plan. They do offer, in many cases, they offer things that benefits that Medicare does not cover, like dental and hearing aids and vision. So again, it's really up to you. But those are the considerations you have at this time during the year to think about. Do you want to investigate your options? Now, if you're on original Medicare, and I'm sorry, I'm going to make one more comment about the Advantage plans. Within the Advantage plans, the drug plan is rolled into that premium. So if they're charging you a premium, let's say, you know, $89 for Kaiser, because I know that one by heart, then you get the Part D drug plan as part of that. There's not an additional premium on top of that, okay? Just wanted to make sure I covered that. Now, if you're on original Medicare, Part D is part of that, as we talked about. It's one of the legs of the stool. This year in California, there are 32 prescription drug plans. Some of the lowest monthly premium is $7.20, and the highest one is $130. So there's a big difference there. If you're not on any drugs at all, or you're only on a few, you might look at the least expensive one. But you always want to make sure that your drug is on the formulary for that drug plan. You want to understand if there's quantity limits, like if your doctor writes something that's usually once a day, according to the package insert and FDA approval, but he wants you to take it twice a day, you might have to jump through a couple of hoops, he might or she might, in order to get that prior auth approval to allow you to have 60 pills in a month versus 30 pills in a month. There might be preferred pharmacies. So if you're going to, you know, Joe's pharmacy down the street and they don't have a contract with your drug plan, then you might not either be able to get it filled there, or it might cost you more to get it filled there. So these are the things that you need to consider when not just the low premium, but the whole cost of your drug plan over the course of the year. Again, we can help you find resources if you're having trouble paying for your drugs, hook you up with Medi-Cal or low-income subsidy from Social Security. But really, we can help you, guide you through what would be the most, you know, the 3 plans that you might consider given the drugs that you specifically are on. You can go to our website, and I think Franklin's going to send this link out to you. You see these 8 buttons here. This button where it's got a big arrow pointing to it, you can go on there and you can fill out a worksheet, which me and my colleagues, my other volunteer colleagues in the home office, people in Petaluma, will send to us, and we will run the report for you and send it back to you. Or you can just as easily go on Medicare.gov and you can do that yourself. So that's an option that you have, and we're more than happy to help you. We'll give you 3 options that that come up as the least expensive given your drugs for the, for an annual estimated annual amount. And then you can make a choice whether you want to switch. But if you don't do anything, you'll end up just getting rolled over into something. And that's fine because it's a no-brainer. You don't have to do anything. But it's always good to at least take a look and say, well, it's only about $5 difference. I think I'll just stay put where I'm at. And the same thing when we talk about changing your Advantage plans. So again, not to belabor the part, but D is the right answer to this little question. The companies change, the premiums change, deductibles change, formularies change, the pharmacies that are preferred, and tiers and the copays change. So that's every year that happens. And every year between October 15th and December 7th, you have the opportunity to decide based on those changes if you want to make a different choice. So circle that date on your calendar. And, we'll probably be doing the same kind of presentation next year if you need a refresher. But this is something that you should be thinking about now and not wait till December 7th, because if you have any questions, it's going to be a lot harder to get a hold of somebody to help answer at a health plan or a drug plan to help answer that question. So if you want us to do that report for you, or if you want to go on Medicare.gov and do it yourself, this would be the time to do it if you're on original Medicare. So back to the C's, the Advantage plans. In Marin, there are 14 plans. Now HICAP covers six different counties. I'm going to presume that most of you are here in Marin, and we have 14. And for the first time, we actually have 2 PPOs. Now, the difference between a PPO and an HMO is I call it a locked system. It's like Kaiser, only it's out in the community, like an Anthem or an Aetna or a United Health, Secure Horizons. But they have a gatekeeper. They assign you a primary care, and you have to go see that primary care in order to get any referral, whether it's for an orthopod or a X-ray or anything else. And that's all about making sure that, we just don't spend money to spend money. A PPO also will say, well, here's a primary care doctor, or you tell us who you're already seeing, and we can tell you if he's in our network or she's in our network. And if you want to see a specialist, there's a cost for out of network and there's a cost for in network, but you can basically go wherever you want. As a matter of fact, we just had a talk from Western Health Advantage, which is a newcomer to Medicare Advantage plans. And they have structured their HMO very much like a PPO, in the sense that you can go, if your doctor says, I want you to go see somebody at UCSF, they won't get in the way of that decision. Now, that's what they say, but I'm just telling you that they feel that they've got a little more flexibility than a typical HMO. So, each plan has their own premiums, like I said, but you always pay the Part B premium that your income level has been assessed at. This year, as I said, it's $144.60. And then you pay the premium to the health plan. They vary their copays by treatment. So in other words, if I'm looking at a United Healthcare HMO, if you went to the emergency room, it would be $90. If you went to a specialist, it would be 20%. If you went to urgent care, it'd be $65. And then like with Kaiser, there's $20 for primary care visit and $30 for specialist visit. So these are the kinds of differences. And then the difference between original Medicare and one of the differences and an Advantage plan is that with original Medicare, you know, I talked about that 20% every time you went to the doctor after you met your deductible. Medicare pays 80 and you pay 20. And if you didn't have a Medicare Advantage plan, you would be, if you go to the doctor a lot or you have an MRI, it's a couple of grand, that 20% adds up quickly. And so with an Advantage plan, there's always this thing called a maximum out of pocket. Each year, the maximum that the Medicare allows a plan to charge you changes, but they can go as high as $7,500 or at $3,400. So let's just take Kaiser as an example. The out-of-pocket cost for Kaiser in 2021 is $4,900. So that means you go to the doctor, you go and get lab, you go and you had an ambulance visit and you had a specialist visit and you went to an urgent care. When all of that added up to $4,900, then you wouldn't have to pay any more out of pocket. So that's the way that works. It's called maximum out of pocket, or MOOP. They do have additional benefits such as vision, dental, and hearing, which I already talked about. Also, what we've been seeing a lot now, not only with Kaiser, but with some of the newer plans like this Western Health, if you were sick and were home and you needed food brought in, they would pay for so many meals a day. Another new aspect is if you had a lot of over-the-counter stuff like, toothbrush or whatever, they give you a $50 quarterly coupon or a card, and you can go spend that on anything that is over the counter, toothpaste, vitamins, Depends, whatever. So those are some of the things that some of these Advantage plans offer. And, some of them are for profit and some of them are not for profit. Some of them are nationally established health plans like Aetna and United and Anthem. And some of them are more local. But you basically are saying, you guys take care of me. And the government's saying, yes, take care of Mrs. Jones, and you take the risk. The plan takes the risk. So I just say all of this so that I know you're probably like me, getting a whole bunch of stuff in the mail and you don't even know what the heck they're talking about. So now you do. And you can maybe assess a little more when they say we're less expensive than anybody else. Well, again, if you are having to go to the doctor on a routine basis, those out-of-pocket costs can add up. So the premium might be less, but that doesn't mean your cost is less. So those are just some things that you have to think about before you make a decision. And there we are. Any questions so far, Franklin?
Now we have a few questions. So,
Okay.
So the first one, is it better coverage to have Med Advantage or the supplemental like Blue X?
Well, the supplemental plan with original Medicare allows you to go any doctor you want anytime without anybody saying you have to pass go first. You don't have to ask anybody, you just go. So if that's a flexibility that's important to you, if you already have an established relationship with cardiologist or orthopedist or dermatologist, then that might be, and you can afford the premium for the supplemental plan as well as the drug plan and the Part B, then, that's what you should do. I mean, that's a possibility. That's your choice. If some of the if saving a few dollars, but still having some flexibility, then you might want to look at one of the PPO plans. Your doctor might already be in that network, and it might not mean a lot of changes for you, but it might mean that you have less expenses every month. So those are the kinds of things that you have to think about.
Okay, so the next one was, can you go back to original from the Advantage plan? I think you did answer this already, but.
Well, I'm going to answer it with a little caveat. You can always go back to original Medicare. The only issue will be whether or not you can get a Medigap plan with what's called guaranteed issue. And guaranteed issue basically is an insurance company that is approved to offer a Medigap plan has to guarantee that they will give you the best price for someone your age, your sex, your smoking status, and in the zip code that you live. That's the protection that was given to us as consumers under the Affordable Care Act. They can't ask you, did you have cancer before? Have you had, psoriasis or whatever? They can't ask you any of those questions. And that's for a certain time frame where that guaranteed issue is in place. If you have been in a Medicare Advantage plan and you're not moving out of the county and you want to go back to original Medicare, but you've been in any Advantage plan in this county for more than a year since you became 65, or from the time your Part B as in boy, Medicare became effective, then you may not have that guaranteed issue to go back and get a Medigap policy without questions asked. If you move out of the county, then it's just like you're all brand new again, and you can choose whether you want original Medicare with a guaranteed issue Medigap policy or another Advantage plan. So it's a little, yes, you can go back to original Medicare, but there might be some bumps in the road that would preclude you from getting the best price that you can for a Medigap policy. And if you want more information on that, again, I'll encourage you to go on our website and sign up for one of the seminars on Medigap plans, or ask for an appointment to speak with a counselor like myself.
So the next one is, do all doctors take Medicare patients?
Most doctors take Medicare. It's Medi-Cal that not every doctor takes. Medi-Cal is a pretty skimpy, if you will, reimbursement plan for them, but most doctors will take Medicare. What I really would encourage you, if you're just starting to look at going back to original Medicare, make sure they take new Medicare patients, because they only have, I look at it as there's only so many seats in this waiting room, and some of them are employer group private insurance, and some of them are Medicare. And if they have all Medicare, they might not be making ends meet. So most doctors do take Medicare, but you want to make sure that they're taking new Medicare patients if you're not currently with them.
Okay, and then someone is asking, can you give us an example of a Kaiser copay that add to the
Okay, so let's say here. So here we have Kaiser. It's going to charge you $89 a month. So the premium doesn't go towards your MOOP, but you were in the hospital for day one for 3 days. That's $285 a day times 3. So, $800. And then you had some outpatient surgery. You had hip surgery. So that's $250. And it would take you quite a while to get up to $4,900. I mean, you'd have to be going to the doctor a lot. You went to urgent care for $20 a couple of times a month or a couple of times a year. You had some x-rays for $30 and some MRI for $200. So that's how it all adds up. But I can tell you, if you took that $4,900 and divided it by 12, it'd be about, about 600, I don't do math in my head too well. But let's just say it's $5,000 divided by 12 months. You'd have to spend about $400 out of pocket every month to meet that $4,900. So you'd have to spend all those copays, would have to add up. So I don't know many people that happens to, but I don't know. again, if you had a chronic disease that, or some acute episode, it might add up quickly, especially if you had several days in the hospital. Okay, anything else?
So yeah, the next one, Lauren's asking, I have an Anthem supplemental. Where do
Okay.
I get Part D if I don't have Part D yet?
Okay, so you would go to that Medicare.gov and site that I told you about. If you did get your Medicare booklet for 2021, it's got, for some reason I can't find mine right now, but it's got two people on the front. It should have come in the mail. You'll see in the back that there's a list of all of the Northern California Part D drug plans, but you can also go on that website of Medicare.gov. Tell them there's like a question and answer, or we can help you if you give us a call. If you have your medications, you can fill out that form and we will give you the names of the 3 plans that best suit what you're on. And then you call them and you tell them, here I am. They will ask you when you were eligible, like what's on your Medicare card. If your Medicare card says your Part B started this year, so let's just say June of 2020, then you shouldn't have to pay any penalty for a late enrollment. Or if you were in, you got Part B, but you had a drug plan through your spouse's work, then you wouldn't have to pay a penalty. But there is a 1% penalty for every month that you were eligible to sign up for Part D drug plan and you didn't. It's 1% of a national average. So it's about 34 cents for every month that you didn't sign up. And the longer you don't sign up and you wait until you need it, it adds up. So I encourage people, even if they're not on any drug at all, to take that $7.20 one and just sign up. And next year, if you are on drugs, you can start looking around again between October 15th and December 7th. Oops, sorry. Okay. So that's where you would go, what I have on the screen, the Medicare.gov, or you come to our site and fill out a form.
So the next question is a several part one. So she's asking, what is the next step? Do I call my current healthcare supplemental provider, ask about their PPO? What do I do next?
So what you should do next is, if your supplemental plan has a Medicare Advantage plan in Marin, you'll know that by going to Medicare.gov. Back to that. I gotta find it now. Sorry. You go to back to Medicare.gov. You put in your zip code and you say, I want to look at Medicare Advantage plans. And it will give you all the Advantage plans in our zip code in Marin. And you can see if you have like Blue Cross or Anthem supplemental, they do have an Advantage plan here in Marin. And you can call them and walk through with them what they're offering and how much it's going to cost. But I would encourage you to call, one of the other plans, whether it's Aetna or United Healthcare or this Western Health, but you'll get the whole list of these off of this Medicare.gov website. Or again, you can call us or email us and ask for a one-on-one counseling session with a volunteer. And we will send you all that information after we've talked and you want to know what your options are. But what you would do is you would call the 800 number that is on this site for each of those Part D drug plans and Advantage plans.
Okay, and the last question is Medigap the same thing as a supplemental?
Yes, Medigap / supplemental, it's the same thing.
Okay, so that was all the questions for now. So
okay, Let me catch up to where we were. I was telling Franklin, this is the first time I've used this slide deck that our director put together. So I'm still kind of feeling my way around here. Okay, so this is some of the things that we've talked about already. If you are considering moving to an Advantage plan, you should consider your lifestyle. Do you travel a lot? And what are the options for you if you're in an Advantage plan here in California that doesn't have a network or doesn't have a plan in Massachusetts? You know, how does that work? If you have relatives back there or family or whatever, you might start traveling again, and that would be a consideration. Frank, my director thought this was important. I'm not sure. I mean, we all know people have to get paid for the job they do. So your broker gets paid for signing you up. So to the lady or the person who asked, shall I just call my supplemental plan and ask them about an Advantage plan? Sure. But you know, they're going to tell you things that they hope will encourage you to sign up because they get compensated that way. There's nothing terrible about that. It's just that that's their MO. That's how they get paid. I don't know a lot of bad stories about insurance agents. I'm sure there are some out there, but they really do try to do their best to tell you all of the ups and downs, because they want you to come back and they want you to refer your friends to them because you helped them and you gave them good advice and you didn't sell them something that they couldn't afford or wasn't worth it. But it's also important for you to take some of the questions that we've generated about, you know, can I see these doctors? And you know, what happens when I go out of state? And, you know, how much am I really paying for all this out of pocket if I have a chronic disease, and how hard is it for me to get a referral to a specialist? You know, that's a lot of the things that you just have to keep asking until you get an answer that you're comfortable that you've gotten the best answer that they can give you. Just don't let them oversell you, I guess, is my point. They do have the advantage of having additional benefits. And you have to, though, really ask, like, okay, we have a vision benefit. Okay, how much is it? It's, you know, one free eye exam a year and $100 towards your glasses. Okay, well, where can I get a free one at Costco? Can I get glasses free, you know, cheaper than at Costco? Is it worth that additional premium to get the vision care? That's what you have to kind of figure out. Same thing with dental. Though they may, for additional premium, they may, like Kaiser has a dental plan, vision and hearing, for an additional $16 a month. It'd be really hard, I'm going to tell you right now, to find a dentist that takes Kaiser, because they're like Medicare. They don't pay a lot. So, you know, should I pay that extra $16 or should I just save that $16 and put it in a little fund for when I need to get my teeth cleaned, or I need glasses, or whatever. Hearing aids, again, it's usually, they'll give you a hearing test, but they'll give you, you know, a couple of $100 towards a hearing aid, whereas Medicare doesn't give you anything. And again, you have to weigh that against the additional premium you're paying month in, month out when you don't need a hearing aid. So again, it might be better to just take that extra money and put it aside for like a healthcare spending account for when you really need it. And, you know, here's the example that the slide shows about, do you ever reach that maximum out of pocket? Like with Kaiser, it's $4,900, and we did the math, it's about $400 a month that you'd have to spend in order to reach that. So it's a pretty bad medical year if some of the plans might have $7,500, like United Healthcare has a HMO called Assure. They have a maximum out of pocket of $7,500. 75.50, and you can see the math here. You'd have to spend $629 a month on average in order to meet that 75.50. But if you're not going to the doctor a lot, then $26.60 for their premium plus your Part B premium might be great, you know, because their doctors are in your network, or you're with Kaiser and you're paying $89 and you want to, you know, switch to a less expensive plan. So again, though, these decisions are not something that we can tell you what to do. We can just help you think about what questions you want to ask and what you want to consider. Okay. And I also want to just say there are some Medigap plans out there, Medigap Supplemental, you see that used here in this slide together, that offer some innovative things like vision and hearing. But they do have to tell you, here's our standardized coverage, and this is how much it costs you a month. And here's the additional innovative stuff like vision and hearing or whatever. And this is how much it costs. So you don't have to take the innovative one if it's not really worth it. So again, here's just a picture of the slide deck for Medigap supplemental plans, what you may or may not know. That is a seminar like this one that's offered virtually now. And you can go on our calendar at HICAP and find it if you want a more comprehensive deep dive. Or again, you can see if you can set up an appointment with one of our Marin counselors. I'm one, and I think there's 3 other people here in Marin, or any counselor for that matter. So that's really it as far as choices and changes and choices for the AEP timeframe and for the original Medicare Part D. But there were some changes made by the federal government with regard to COVID. And one of them is that Medicare covers the lab test for COVID-19, so you pay no out-of-pocket costs. So if you went and got a swab, you should not have gotten a bill if you showed them your Medicare card. Now, what I don't know, and I'll be honest with you, is that if you had more than one test, does it cover more than one? That I don't know. If you were, God forbid, if you did get COVID and you had to go to the hospital, Medicare is supposed to cover all medically necessary hospitalizations. Medicare Advantage plans were allowed to waive the cost of lab tests. That does not mean that all of them decided to do that. So you should check with your plan about that before you do go and get a test. Because of COVID, and in order to continue to encourage people to see their doctor, they did expand, excuse me, and approve the use of telehealth services so that Medicare would pay, if you're on original Medicare, they would pay part of the bill, and so would your Medigap plan. And Medicare Advantage plans have been allowed to use telehealth as part of their way of delivering care to you. They also, in certain cases, if the drug plans and or the Medicare Advantage plans agree to it, they could waive or relax prior authorization requirements for particular drugs. And also, excuse me for a minute, I just have to take some water. And also, one of the things with Part A, hospital coverage with Medicare, in original Medicare, if you're on that side of the equation with the 4 stools, if you were to go into the hospital for some surgery and you only stayed for 2 nights, but you still needed rehab, you'd go to the rehab and that wouldn't be covered at all. You'd have to stay in the hospital for at least 3 midnights in order for the first 20 days of your rehab facility to be covered. that's been waived during the coronavirus. So if you're in the hospital, whether it's with COVID or not, and the Medicare and the doctor says, okay, you only need 2 nights here, they'll still send you to the rehab facility and not charge you the full cost of each days of care. And you can find that on under Medicare at medicare.gov for the coronavirus. This is nothing new. It's just that during the COVID crisis, there's been a lot more scamming going on by unscrupulous people. And they'll calling you saying, you know, if you want a free Medicare test, just give us your Medicare number and we'll set you up. We want to remind you, never, ever, ever give out your Medicare card number to someone on the phone. Medicare will not call you. You will call them, no doubt, but they will not call you out of the blue unless you had an appointment and an arranged time with them. So just to be cagey, always get their phone number to call them back, because if they're for real, then they might actually answer. But trust your intuition, and if you have any concerns that something might be fraudulent, call this number under our Senior Medicare Patrol. And then for the first time, people in the past, people who had end-stage renal disease could not enroll in a Medicare Advantage plan, and now they can. Not all Medicare Advantage plans will have opened the door to them, but a Medicare Advantage plan, if they wanted to, they could treat patients with end-stage renal disease. They've also allowed now in 2021 for acupuncture for back pain, telehealth, as I mentioned, and Part D drug plans and Medicare Advantage plans. If they wanted to participate in the Part D senior savings model, they could. I think the maximum, if you're a member of that, if the Medicare Advantage plan or the drug plan decided to take the government up on their offer, they'd have to offer you insulin at $35 a shot or a dose. But I don't think it covers the actual pen or delivery system, the syringe. That I'd have to look up and get more information on that. So if you have a question on that, you can send it to Franklin and he can send it to me, and I'll try to get more answer for you, but that's all I know right now. And then if you were tragically affected by any of the fires during this recent period, and your area was declared a evacuation or declarations of emergency, you do have a special enrollment period to either change your Medicare Advantage plan or change your drug plan. So if you were impacted by this, by these fires, you have an additional 2-month period after December 7th. So that's really everything. What I would like to ask you to do is 2 things. First of all, we're a nonprofit. There's not a lot of money for advertising, which is why, even my friends that I play pickleball with, they're like, I never heard of this. And I said, well, neither had I until I met somebody and they told me about it. So if there's a way that you can help spread the news about HICAP, if you write a newsletter to any of the organizations you belong to, it'd be great if you would let them know that HICAP is here to help them. And if there's a presentation that's needed, Frank, our director up in Petaluma, will set that up. Also, if you are interested in doing something, volunteering, I can tell you that the one-on-one counseling that we do is very rewarding. It's nice to be able for people to go, oh my God, I didn't even understand this, and now I do. Hopefully that's how you feel today. But you do, if you're not comfortable doing these kinds of presentations, don't worry, that's not, not everybody has to do this. It's more about the day-to-day interaction with people that we'd be happy to have your help. So with that, if there's any more questions, Franklin, I'd be happy to answer them.
Does anybody have any more questions, or just type them into the Q&A box? So far, nothing's coming in. But don't forget, I'll be sending up a follow-up email with a link and a lot of the links that were talked about today in today's talk. So again, thank you, Geri, for this presentation.
Well, thank you for setting it up, and thank you everyone for your questions. And I do hope that you have a wonderful day and that you feel at least a little bit better informed.
Okay. Thanks, everybody. Have a good day. So, bye, Geri.
Bye.